Hi, my name's Ocean Kabikwa. I'm one of the physiotherapists at Alchemy in Motion. My area of interest and expertise is pelvic health, so I love helping women, men, and children with various pelvic problems. I'm very passionate about all of my work, so it's hard to choose a favourite, but I love working with women when they're pregnant and after having their babies because there's so many things that can be done to minimise risks of pelvic problems and make a lifetime of difference. Screening for pelvic floor risk factors, teaching pelvic floor coordination to make it easier to push babies out, exercise in pregnancy and getting back to your exercise goals afterwards, rehabbing abdominal muscle separation, preventing and managing various aches and pains that can arise when you're pregnant or after having the baby. I love managing prolapses in women of any age, and I've done extra training that enables me to offer pessaries as an option for some women. For men, women, or children, I love helping with bladder and bowel troubles such as going too often during the day or overnight, constipation or difficulty pooing or weeing, incontinence or urgency when you're struggling to make it to the toilet before wee or poo start leaking out, recurrent urinary tract infections or symptoms of them, irritable bowel syndrome, bedwetting in adults or children as long as they're at least 5 years old. In men and women, I love working with chronic pain in the pelvis, including things like endometriosis, adenomyosis, pudendal neuralgia, prostatitis, interstitial cystitis, bladder pain syndrome, or painful sex or arousal, and preparing people for pelvic surgeries and rehabbing afterwards to get the best outcomes for operations including prolapse repairs, prostatectomies and hysterectomies. I moved to the Sunshine Coast in 2019 to be closer to family and I'm loving it. It reminds me of the little surfy retirement oasis that I grew up in when I was a kid. I moved to Perth to do my first physio degree, which I finished in 2008. And from the moment I did my first prac at the maternity hospital there, I knew that pelvic health physio was for me. So after 3 years of various types of physio work, including pelvic health, I went back to uni and did my master's in continence and women's health and pelvic health physiotherapy, which is the only type of work that I've done for the last 8 years. And the more I learn, the more I want to learn. When I'm not working, I'm just trying to play more beach volleyball and hang out with my hubby and our two girls. My approach to my work is to try really, really hard because I care about everyone that I see, and it's about your individual goals rather than assuming that everyone wants or needs the same thing. I like helping people achieve their goals and make their own well-informed choices. I have no agendas for or against surgery or for vaginal birth or cesarean birth. I don't think those sorts of decisions are a one-size-fits-all. It's just about minimising risks and maximising benefits for you in light of your individual factors. I value teamwork, especially when it comes to more complex problems. I think the best outcome is often when more than one area is addressed by people with the right expertise and sometimes at the same time. I'll never try and keep you to myself if I can't offer the service that you need most. For example, lots of people come and see a physio to figure out whether they will need surgery or not, and often surgery is avoidable. And if that's your goal, then that's great. I'll try and help you get there. But sometimes after a couple of assessments, you can assume that you could pelvic floor train until the cows come home and it won't necessarily change much. If I suspect that, I'll be upfront and let you know so that then you can choose whether you want to spend months pelvic floor training or not. I'm very honest about my own limitations. If I don't know the answer, I'll just tell you and try and help you find someone who might know the answer. And most importantly, I'm not here to judge. Anyone is welcome. and I'll listen to anything that you're brave enough to share. Thank you for choosing Alchemy in Motion. I look forward to meeting you and helping you towards your goals.